other one is more somebody who would be having shoulder problems, whose lats are tight. All right. Pecs. Do you mind staying up here?
No.
Okay. Long sit on the table for me. So legs straight out in front of you. Slide down a little bit. You're going to lay down on your back. Yeah, slide down towards the feet. This is my favorite pec stretch. I like to do this with patients. You can use a pillow or you can use a towel. You don't have to have quite as big as a pillow. Or a half foam roller is really nice. The ones that are flat on one side, curved on the other side. You're going to put that pillow in between the scapula and about the whole length of the thorax. So go ahead and lay down on that toe. All right. Now go ahead and put your arms to your side first, just so I see how much you can take. Little less aggressive if you let them rest their arm at the sides. You're going to use the heel of your hands, and you're coming into the muscle belly of the pec. So think pecs running this way, like this. So I externally rotate my shoulders, bring the heel of my hands in, here, here, and then just push back.
So you do them both at the same time, all the time?
Yeah, you have to.
Even if it's left or right?
Yeah, you need to be able to stabilize. If you just do one side, they kind of roll instead of getting that pec stretch. But you want to be into the muscle belly a little bit. And push out towards your fingertips, kind of on an angle.
How's that feel, Tony?
Think direction that they run. So you don't want to do this, because that's not where they run. Even though you're pushing the shoulders back, that's not the way the pecs run. Pecs run on and they run this way. So you're coming like this. Now, if I want Tony to help me, because I don't have to work so hard, we're going to bring the arms open like that. And that's probably enough stretch for him already without me even doing much of anything. But then I can really get in there. You all right with that?
Mm-hmm. It's definitely pulling in. Feel pulling on the sternum.
To get a really effective pec stretch. And then I have people, they'll just do a passive stretch like this at home. I'll teach them to roll the towel roll up. They lay on their beds, let those arms open, tell them a couple minutes, so they'll hold that stretch just like gravity in the weight of the arm. Pull them open for a couple minutes, relax them, a couple minutes, relax them. There's an ART technique too. I showed you a little bit of ART before. There's a nice ART technique for the pecs that works really well. You're going to bring your elbow in. Find that pec tendon and have them open their arm.
Are you applying pressure with your...
I'm applying pressure with my thumb. And if they're really good and they can do it on their own, I like to use 2 thumbs because the pec is fairly wide. Go ahead and push your elbow back. Good. Come on back
I
up.
can feel that.
Good. Make it come again. And for shoulder patients who have really tight pecs, this is a really nice release. And you'll see a big difference in their scapular posture. Good. Scapular position when you're done with that. And then you just work, as far into the pec as you can. You can work a little further into a man's pec than you can females. You need to be reasonable about where you're putting your hands. Females I tend to do about this much and leave it. Men will come down into their pec a little bit more. All right, so that's one way. You're working with athletes. Another way that you can do it, Tony, go ahead and sit up. I'm going to sit in a chair for you. Another way that you can do it is to have a patient sit in a chair and bring your backside all the way to the back of that chair, sit right against it, and bring both arms up shoulder level for me. And just hold them there.
Ooh, I like
Stretch
that.
like that. I don't do this with my patients. not good for anybody who's got any kind of anterior instability because you're using kind of a wide, long lever arm.
Just let them go.
Yeah.
Make a wish.
But you can see where, that humeral head, when I do that, is going to be pushed right against that anterior capsule. Not something you want to do with anybody with any kind of shoulder instability. So if they would have a labral tear or they've dislocated at some point, I don't want to do that. It's an aggressive stretch, and you can get a lot of stretch on them without a lot of effort on your part, but it's not as safe as putting somebody on the table and stretching. That's a much more stable position. All right, let me take this pillow out.
You were in a sport clinic where you did have more athletes and that would
Yes.
probably be something.
Yes.
Because I can feel that one way with it.
Okay, bicep. The bicep stretch, I told you need to make sure that your scapula is sitting where it should be. So if that scapula is kind of pulled forward, which a lot of people are going to be anteriorly tipped, then I need to kind of put it back where it belongs. Again, you're using that kind of that upside down C grip, so like that. And you're going to come across the top, and I use my thumb to kind of push down the back side of that scapula and hold it down there. So you see how rotated I have the scapula? I have it rotated like right where it should be. And then this arm, hold right above the wrist, pronate the hand. And then I don't have to go too far. You feeling that already? Watch the difference if I don't stabilize the scap well. Okay, if I just put my hand up there loosely, nothing. Maybe a little,
Yeah.
but it's not going to feel much.
Nowhere near.
Nowhere near what I had before. All right, because the scapula is too free to move, so it's going to change where the origin of the bicep is. So, put it where it belongs. Stabilize it good and firm. And then put your stretch force on. You have to keep that elbow extension. And then pull them back into shoulder extension. Okay? As you do that, that is to stretch the entire length of the bicep. Now, if somebody's got an elbow flexion contracture and they're here, that is not how I would choose to stretch the bicep. Because I need to stretch more of that distal end. So I would want the upper part of the humerus more stabilized. I would put them on their back on a table, stabilize kind of above the elbow, and then put my pressure on. And we'll do that when we do joint stretching. Okay, the last one, the tricep. Shoulder extension, it's a shoulder extender, elbow extender, so we flex and flex. I'm going to start with, you can pick which joint you want to start with, but you're going to go over pressure here. See how Tony immediately wants to come out this way? All right, he does that because when he's here, he's going to get already a stretch on his tricep. So I don't have to work very hard. When he comes out here, that's lats. He just immediately put himself into a position where he's taking the stretch off his tricep and going more into the lat. So we go here. I want his scap to stay stabilized, so I usually use my hip and kind of push in there. Let me turn my ring in so I don't cut your chin. Come in this way. Okay, you can see I can easily use my stretch techniques here. So if I get Tony towards end range, push down into my hand, easy. Good, relax. How much more you just got? Than me trying to manhandle him. Okay, that's a tricep. All right, go try those.